Hi everyone. Today I'm diving into an essential topic for healthcare professionals: how to prevent cervical cancer screening and vaccination tips. First things first, cervical cancer screening is crucial for early detection and prevention. Let's talk about the two main screening tests, the Pap Smear and the human papillomavirus (HPV) test. Starting with the Pap Smear. During this procedure, a healthcare provider collects cells from the cervix using a small brush or spatula. These cells are then examined under a microscope to detect any abnormalities. For women aged 21, 29, a Pap smear is recommended every 3 years. For women aged 30, 65, they should have a Pap smear every 3 years or co-testing with an HPV test every 5 years. Imagine a 25-year-old woman visiting her gynecologist for a routine Pap smear. During the exam, cells are collected and sent to a lab. The results come back normal, and she's advised to return in 3 years for her next test. Now, let's discuss the HPV test. Similar to the Pap smear, cells are collected from the cervix but are specifically tested for high-risk HPV types associated with cervical cancer. Women aged 30, 65 can opt for co-testing with a Pap smear every 5 years or an HPV test alone every 5 years. Think about a 32-year-old woman who opts for co-testing. Her HPV test comes back positive for a high-risk strain, but her Pap smear is normal. Her doctor advises close follow-up and possibly a colposcopy to examine the cervix more closely. Moving on to prevention. The HPV vaccine protects against the most common high-risk HPV types that cause cervical cancer. The vaccine is recommended for preteens, boys and girls at age 11 or 12, but it can be given as early as age 9 and up to age 26, and in some cases, up to age 45. Picture a 12-year-old girl getting her first dose of the HPV vaccine at her annual checkup. She returns for the subsequent doses as per the schedule, significantly reducing her risk of developing cervical cancer in the future. Safe sexual practices also play a role in prevention. Using condoms, limiting the number of sexual partners, and avoiding smoking can reduce the risk. Consider a 22-year-old woman discussing with her nurse the importance of using condoms to reduce her risk of HPV infection and subsequent cervical cancer. Regular screening is vital. It can detect precancerous changes in the cervix, which can be treated before they develop into cancer. Imagine a 45-year-old woman with no prior screening history starts regular Pap and HPV testing, enabling early detection of any abnormalities. Nurses play an integral role in cervical cancer screening and prevention. They educate patients about the importance of cervical cancer screening and HPV vaccination, administer the HPV vaccine, and ensure patients complete the vaccine series. Nurses also perform screenings, provide counseling for patients with abnormal results, and assist in coordinating follow-up care. They participate in community outreach programs to raise awareness about cervical cancer and the importance of screening and vaccination. In conclusion, cervical cancer screening and prevention are vital components of women's healthcare. Regular Pap smears, HPV testing, and vaccination play critical roles in reducing the incidence of cervical cancer. By promoting these preventive measures, nurses help ensure better health outcomes for women. Thanks for watching. Don't forget